Madame, je dois quoi ici?
Endless waits for patients.
Eh, j'ai rien à faire là! Eh, tu m'as mes affaires, je me casse!
Grueling conditions for medical staff.
They tell us we don't have space, so we try again the next day and the next and the next. They can't keep saying that.
And the stigma surrounding mental health.
There are just as many stereotypes hanging over psychiatric doctors as there are for patients.
Mental health conditions affect 1 in 5 people in France. The government's named it a priority issue for 2025. We've gone to the emergency psychiatry unit in Saint-Denis in the Paris region to see it up close.
Bonjour. Comment ça va?
Bah ça va, juste un peu, je tremble un peu.
Ouais. Là, vous avez passé une nuit difficile. Vous êtes au courant quand même. Ce qui s'est passé nous inquiète.
Oui.
Donc il va falloir peut-être qu'on se donne le temps de vous évaluer tranquillement, de vous donner un traitement.
J'ai été dans un état de démence quand je suis arrivée à l'hôpital, à cause d'une drogue qui s'appelle le 2CB.
Ça fait combien de temps que t'es là?
Bah ça fait 3 jours.
3 jours que t'es dans ce couloir?
Oui, parce qu'en fait, ils ne savaient pas trop me mettre, parce que j'avais une situation compliquée et tout.
This very young woman is now being seen to by Dr. Moifak.
Je marche un peu vite.
Another busy day with no time to lose. Visits to the emergency room for psychiatric incidents increased by 21% between 2019 and 2023 in France. Faisal Moifak has been head of this department for 10 years now at a hospital in Saint-Denis.
Toutes les démarches.
I have to complete all the legal administrative procedures. That's one of the slightly annoying aspects of our workload. We have a lot of paperwork.
Dans notre fonctionnement, c'est qu'on a beaucoup de paperasse. Au suivant, allez.
Celui-ci, c'est le monsieur qui est en France depuis 5 ans, d'origine tunisienne, inconnue. Ici, pour une patient d'agitation, il est complètement sur la boîte.
Bon, allez, on les voit comme ça, petit à petit, on évacue. Bonjour.
This is Dr. Moifak's obsession, moving patients out of the emergency room's corridors as fast as possible.
Ouais, ok, ensuite.
Here, the noise and commotion can aggravate their symptoms.
Valium 10. On ne sait pas ce qu'il a pris de là.
4 patients spent the night on these gurneys.
Vous avez quel âge?
37 ans.
37 ans.
3,9 divisé par 26 est égal à 161.
Dites-moi.
Ou 27.
Vous êtes suivi en psychiatrie? Vous avez un suivi?
J'ai été de nombreuses fois en psychiatrie. C'était dur.
Alors nous, on est psychiatre. On est là pour vous trouver une solution. Ouais.
Va pour la psychiatrie.
Va pour la psychiatrie. Bah oui, on n'a pas trop le choix là.
Ouais.
Je pense qu'il va falloir vous hospitaliser.
But they'll have to find him a bed. The young man's probably homeless. He was found in a delirious state wandering the streets. Dr. Moifak has managed to get him transferred. No small feat.
Akima, il peut partir tout de suite. Hein. Il peut partir tout de suite. Oui, chez moi. J'ai trouvé une place chez moi. Oui, au CRUP.
On peut y aller.
The CRUP is a secure psychiatric emergency wing.
C'est bon, monsieur, on va y aller.
C'est mes affaires?
Oui,
Je peux les prendre près de moi?
bien sûr. Vous êtes à l'hôpital?
The patient's taken a few corridors away to a specialized facility. This wing of the hospital opened 2 years ago. It treats around 15 patients until they're able to return home or until there's a vacancy for a longer-term stay. It's a much calmer setting. Patients have their own rooms, and it's life-changing for them and for the medical staff.
We'd reached a point where even I couldn't see myself in my job anymore. We had patients who spent 1, 2, 3, 4 days in the emergency room, and all we could offer them was restraint and sedation. It was really difficult for us. It's hard to see, it's hard to put up with, even more so for the patient. So now, yes, this makes our work feel more meaningful. It really changes things.
Dr. Moifak has been spearheading this initiative since 2016. It finally came to fruition after the pandemic. The effects of COVID-19 have seriously damaged the mental health of many people in France, especially the most vulnerable. Saint-Denis is the poorest district in the country.
During COVID, decision makers became aware of the difficulties we face in psychiatry because we saw waves of patients suffering from severe psychiatric disorders flooding in. And that's when we secured a budget of several million euros.
They've managed to carve out more space, but doctors still spend a good part of their day searching for beds.
À Avicenne, il y a combien de patients en attente, pardon, Nicolas? Faten, il y a
J'ai 5 patients sans orientation à Avicenne.
Non, moi j'ai 10 patients.
10 patients.
According to a parliamentary report, 8,800 full-time positions in psychiatry have been cut in French public hospitals over the last 15 years.
The most frustrating thing is searching for a bed. When we call the referral sectors, they tell us we don't have space. So we try the next day and the next and the next, and then after a while that answer just isn't good enough.
If they were to offer more beds, they'd need more staff. But psychiatry is one of the least popular specialities among medical students.
In my case, it was my first choice, and I don't regret it.
The head of the group, Dr. Chefi, is originally from Tunisia, like Faisal Mouafak. In public hospitals, 16% of psychiatrists obtained their degrees abroad. But they're still understaffed. 1/3 of positions are vacant.
I think people may be afraid of psychiatry because they see it as an aggressive environment, a violent one. They don't know how it is, really, because there's no more violence here than in any other department.
Monsieur, s'il vous plaît. Calmez-vous là, par contre. D'accord? Ben, je vous laisse tranquille, mais par contre, vous ne pouvez pas trop toucher à ça parce que la dernière fois, vous avez fait mal à une patiente.
This man was brought in by the police because of his aggressive behavior in the street.
Dégage-toi! Dégage! Salope, les Tunisiens!
Monsieur,
The patient's transferred to an isolation room.
on est les médecins. Je suis le docteur Chefi. D'accord? Là, on va vous installer dans votre chambre. D'accord? Donc, ça doit bien se passer. OK?
The whole team arrives, accompanied by security guards. Suddenly, silence. The mood shifts. They're reluctant to do it, but the doctors have to restrain the patient.
Pas d'inquiétude, d'accord? C'est des mesures qui sont provisoires. Avec le traitement, ça va aller mieux. Là, je ne peux pas, parce que j'ai pas les...
This measure is a last resort and is used to protect the patient from themselves. Often, this type of episode can be prevented with the right medication earlier on.
This is Ipadura. We still have some left for a few patients.
This injectable antipsychotic is effective for 1 month.
Ce traitement-là...
This drug is in short supply, which can be very complicated for patients who have already been stabilized with it. There's a risk of decompensation, of psychological imbalance, for patients who are stabilized. For those patients, it's a step backwards.
There is an alternative to this monthly dose, but the medicine must be taken every day. That can be difficult for vulnerable patients and those in precarious circumstances.
On vous faisait une injection une fois par mois?
Donc là-bas, j'avais rendez-vous au centre de santé, mais ils me donnaient une injection par mois. Ouais.
This young man arrived at the emergency room in a state of schizophrenic decompensation. Once the episode's over, he's saddened to learn of this relapse.
Que vous êtes exhibé.
Je me suis déshabillé.
Oui, c'est ça.
The drug shortages affect several psychotropic medicines, and that can have serious consequences.
Allez, on fait au stop. Pour les infirmières du jaune, pourquoi ce patient qui a 2 heures, il n'est pas installé?
Severe mental disorders reduce life expectancy by an average of 10 to 20 years. Psychiatric treatment saves lives, yet it's sometimes undervalued even within the medical sector.
Il ne peut pas me répondre que c'est normal.
Faisal Moafak and Mathias Vargon, the head of the emergency department, want to put an end to these preconceived ideas.
Very often in discussions, we see these stereotypes coming up, like, psychiatry isn't really medicine.
La psychiatrie dans mon service.
In my department, I asked that psychiatry be considered like any other branch of medicine, but that doesn't always happen.
En fait, c'est une maladie.
The thing is, it's an illness. We prescribe medication just like for other conditions. The medication we give isn't to suppress the illness, because that's what people think. Chemical restraints and all that. No, it's to treat people, in the same way that we would treat high blood pressure.
These are not illnesses that we cure, but illnesses that we stabilize, like diabetes, like most existing illnesses.
They're chronic illnesses.
The night shift takes over. Room after room, the patients gradually turn in for the night. Another secure psychiatric emergency unit is set to open in the nearby town of Bobigny. Faisal Moafak hopes that since mental health was named a priority issue for 2025, this care model will be implemented in other places too. Yet while the issue's in the spotlight, there's been no mention of additional funding for psychiatric emergencies.